coverage and married couples for target couples for family planning counseling. So the rate of institutional deliveries have gone up by 70% since the implementation of this IT application, and significantly higher than majority of the country despite lack of resources and infrastructure in the southern Rajasthan. IMR in Dungarpur is now down to 49 per 1,000 live births, whereas the state average is 65. And MMR has also declined to 281, which show the efficacy of this program. Now Haryana is also planning to implement the pregnancy tracking system. Another IT application, it's to monitor the weight and growth of preterm infants in NICU. So the problem with our country is the high infant mortality rate, and we don't have a software or a standard references or a registry for the standard births of infants in our country. So basically, this program is a screening tool to diagnose diseases in neonates. It detects growth retardation, can have scarring consequences into adulthood. So we don't have Indian data specific to our context. So in this IT application is screening tool where electronic data is captured that is easy to manage and analyze. Maternal and infant information is captured, followed by daily recording of body weight, weekly measurement of recumbent length, head circumference and mid-arm circumference, and other comorbid conditions are recorded in preterm infants by any number of devices that support this application. So application has a feature to display the standard reference curves, plot the weight measurements against the reference curve background, and display the same in a tabular form. The pilot data generated in 35-bedded level 3 NICU of St. John's Hospital shows that the Indian preterm infants fall below third percentile of the standard reference curve for the Western population. So that highlights the need for generation of data specific to Indian context. So basically, this electronic growth chart for charting and monitoring the growth of preterm infants in NICU is a good bedside decision support tool in real-time analysis with multi-point accessibility, which can be used to create a registry that truly represents Indian population. And it can really go a long way in reducing infant mortality rate, and it's important part of MDG. So now the last application which I want to apprise you, which has been a great success story in Western Maharashtra, is Save the Girl Child and Think a World Without Girl Child. So there's a website also, Save the Baby Girl. This project was first launched on 15th August in western districts of Maharashtra, Kolhapur, Sholapur, and other neighboring districts. The project has two-phase application: online submission of record as per PCP-NDT Act, and a silent observer. It's an advanced, secure, and intelligence device embedded to the ultrasound machine that records the video images of the ultrasound. So this device has been developed by Magnum Opus company, and this is called SIOB. It's a device that is attached externally through cables and that captures the video images of each sonography conducted and stores in the local hard drive of the SIOB. So this is the basic schematic diagram of SIOB. And the information logged on to the web server is then collected on the centralized web servers, and application then generates various reports and statistics to identify the key indicators such as total number of patients registered, area specifically, number of MTPs, deliveries, and so it can track the complete pregnancy. The entire data is processed and displayed using online dashboard to have a summary status of entire district on a single screen. The individual login for various levels of district administration is planned so that the concerned authority will view the report on the area defined in a snapshot. And this intelligent and reading careful analysis of generated information and reports by the administration pinpoint the culprit centers. So they come under a scanner where the baby girl or the videography is shown that the MTP has been carried out during the subsequent course of pregnancy. The figures of male and female born in private maternity homes with sonography machines for October to December 2009 indicate improvement in sex ratio in favor of girls. The interaction with medical fraternity, especially with the respected doctors known for their integrity, reveal that the success in improving the sex ratio is due to continuous online monitoring of all center on daily, weekly basis and feedback given to the doctors, radiologists on sonography centers. However, the Imaging and Radiologist Association has moved to High Court stating that it infringes on the privacy of the patients. But one has always to strike a balance in the overall social good and the privacy, confidentiality of the patients. And it has been found in our country that in spite of various initiatives by the government, the sex ratio continues to be adverse, and particularly in regions where the availability of ultrasound machines is high. So that is a bit of paradox, and there's a technological solution, ICT solution that is available to overcome an otherwise recalcitrant social problem, cultural issue which we have not been able to overcome through legislative means. Another application, which in fact is a blend of applications and you are well aware of, is the EMRI. So it's now there in most of the state, and we all know how it improves the pre-hospitalization care, which is a big, highly deficient in our country. It uses various technologies, and say a pregnant woman is there, she can be picked up fast. That means that prevention of premature onset of premature labors can be prevented. And it works on various technologies of GIS, GPS, and call centers, and we all know that how effective it has been. And then, of course, we are well aware of mHealth applications, as the overview has been given, how the voice and text application can help in tackling inefficiency, enhancing the penetration of healthcare services, contacting blood groups, improving the compliance of the patients who are on DOTS, or who are on otherwise, who have to be sent reminder for their appointments, or who have to be administered vaccinations, has improved the delivery of and penetration of healthcare services. Similarly, if it is coupled with 3G networking application, then of course we can send so many other data, GSR and images in DICOM format, ECG clippings, and the vital parameters of the patient. So to conclude, I would like to say that there are specific ICT applications which solely address the Millennium Development Goals and which operate in the domain of public health. So ICT has made the delivery of healthcare more efficient, effective, accessible, and safer across the care continuum for both patients as well as providers. It holds immense promise of changing medical practice towards achievement of Millennium Development Goals. I'm sure you must have watched this ad of IDEA which has been going on recently, which says how 3G can control the population to help achieve Millennium Development Goals. And certainly that is another way of looking at it. If they are distracted with 3G, so that is the idea that the IDEA company has come out with, and certainly that will be an innovative approach in healthcare if that too can help us in achieving Millennium Development Goals. Thank you very much. The difficulty lies not so much in developing new ideas as in escaping from the old ones.